All right, Lagos, Nigeria, planet Earth. Welcome back to the Late Edition on 91.3 FM. It is still the voice of Obi you're listening to, and wow, I am very ecstatic. And if you're very, very much familiar with what soccer team I support, you know why I feel so good. It's really been a wonderful night. It's really been a great night, and there's a different kind of experience that you can get when you find out that not only are you having a wonderful time celebrating an experience that so many people doubted, but then the person you're about to speak to is also on the same energy level, is feeling it the way I'm feeling it. I say, God, what a wonderful time. I have with me a professor, and not just a professor, but a man leading a great association for fertility and reproductive health. He happens to be the president of that association. Please, listeners, join me in welcoming Professor Preye Fiebai. Gunners for life.
Nice to be here.
Gunners for life.
Yes.
Gunners for life.
Yeah,
I was so excited when you actually told me that you are also an Arsenal fan. Talking about sexual and reproductive health. So I want us to, of course, start off, for the sake of people who might not necessarily understand what it truly entails. I want us to start off with Professor talking us through what is sexual and reproductive health and why it is important to us as a people. So, Professor, let's hear you.
Yeah, so health has been defined by the World Health Organization as a state of complete physical, emotional, mental, and social well-being. And this also translates to the definition of sexual and reproductive health. So, a complete state of well-being, physically, emotionally, and mentally in all matters relating to sexuality and reproductive system. It's not just about avoiding disease or unplanned pregnancy. It's also about the right to safe and satisfying sex, access to healthcare, and making informed decisions about one's health and one's body.
Very key, very, very important stuff. And I'm glad that you just pretty much broke it down, because a lot of people do not necessarily understand what it means per se. So I'm glad we're having this conversation. So I want you to also take us through what are some of the key components that are concerned with sexual and reproductive health as well.
So, it's not limited to maternal and infant mortality.
Okay.
But also helps control the spread of sexually transmitted infections and empowers people, especially women, supporting economic and social development. Now, there are various components. As a fertility person, of course, I'm going to mention the fertility aspect first. So, fertility care and counseling. But it also involves family planning and contraception, sexually transmitted infection prevention and treatment, safe pregnancy and childbirth, which most people will relate to, and then comprehensive sex education, which is generally lacking in our society. They also have access to reproductive health services, menstrual health management, and addressing gender-based violence. So you can see the spectrum is quite broad, extending from pregnancy to issues relating specifically to sex itself.
Okay. All right. Thank you so very much for taking us through that, sir. So, with this, it's very clear that there are some major issues concerning our sexual and reproductive health in Nigeria. And it's very, very important that we take a look at it, because I personally believe that I believe it's a gender-related situation, but in some cases, the majority of things that affect us it could really be something that everyone can experience. But I want you to take us through, because it's like I said, it's relatively different with the different genders. What are the biggest challenges to sexual and reproductive health in Nigeria today? The major things that affect the state of the average man or woman's sexual and reproductive health in Nigeria today.
First and foremost, there is limited access to quality health services, especially in rural areas. With the brain drain that we are experiencing right now, it has also extended to the urban centers. And even in major cities like Lagos, Port Harcourt, Kano, and all that you have, majority of our young doctors especially are leaving the country. And the provision of these services is dependent on not just doctors, nurses, the general spectrum of healthcare practitioners. So that's one of the major challenges that we have. Second is cultural and religious beliefs that influence how we think. In our culture, generally, you don't talk about sex, and even parents find it difficult to explain some of these things to their children. And in many religions, it's considered to be a taboo. So it's also a major problem. Then we have a high level of misinformation and stigma. The kind of information that goes around, especially with social media and all, you need to be able to sieve out proper information to get the appropriate thing that will help with your sexual and reproductive health. There's a lot of gender inequality. Women are generally disadvantaged in our society, and as a result of that, there's limitation to what they can get with regards to sexual and reproductive health. We also have poor funding and infrastructure. Our health system is virtually not functioning the way it should, from the primary, secondary to tertiary levels. Government has tried its best and is still trying. The current Minister of Health, they are trying to bring out a lot of policies and changes that hopefully would make a change. But even if you have all the infrastructure, if you don't have the personnel, you are not likely to provide the kind of help that is required. So we have brain drain not only of doctors, nurses are moving away for greener pastures, and all the spectrum of reproductive health practitioners, same applies to them. Then insecurity, displacement, especially those who are in areas with a lot of unrest. Plateau State, for example, the guys in Bokos have all been displaced from their domain right now, and you can imagine the impact it will have on their reproductive health. Same in places like Borno State, and I guess across the whole country, there's a lot of insecurity that's affecting all that we do. Then you also have reduced funding from donor agencies. The United States, we always depend on donation. I mean, we should look inwards, and unfortunately, we depend a lot on support from outside countries. The United States in particular has helped a lot in curbing HIV, STIs, and all that kind of stuff. But with Donald Trump's recent pronouncements, funding has virtually stopped, and Nigerian government is looking for how to contend with this right now.
It's a lot. It's a lot to take in, really. And I'd love for us to get into that, but there's some other questions, that I thought of first off. When you were mentioning some of the key components of sexual and reproductive health, you mentioned contraception, and I'm thinking, there's this mindset that a lot of people have. Oh, maybe, a lot of people do have that, and I want to know for sure. I'm sure quite a number of people too want to get the right kind of information. So I've heard that some contraceptives can negatively affect a woman's reproductive health, her reproductive system. How true is this? Is it something that is very, certain?
Not true, okay? Generally, but it actually depends on the kind of contraception you're using.
Okay.
With most modern contraceptives, they are very safe and they do not cause infertility. A lot of women think that if you use certain kinds of contraception, for example, the intrauterine contraceptive device, otherwise known generally as the coil, it could negatively affect your capacity to reproduce subsequently and has a lot of side effects. When properly utilized under supervision, none of these methods of contraception have any side effects. Not side effects, have any long-term implications on reproductive health. Side effects exists for some of them. I mean, for the combined oral contraceptive pill, for example, some people put on weight and then you might experience mood changes and stuff like that. But this is generally reversible. And before commencing on contraception, it is important that you are assessed by a qualified person who determines what is appropriate for you. The long-term use of some methods, like the injections, for example, may delay return to fertility, but it is not irreversible. Inadvertently, over time, return to fertility exists. And what matters is using the right method for the right individual under medical guidance. Not every method is suitable for everybody, and you should seek help from the health care practitioner to get what suits you.
Okay, so I'm now thinking, because you said to get what suits you, you have to consult a medical practitioner. So is there like a procedure? Because for you to figure out, a lot of times when situations like this come up, women or the conversation might necessarily be in the case of, okay, what is the best kind of contraceptive that I can have that wouldn't necessarily detriment my health? So is there like a procedure they would do, or it's just based off conversation? Because from the way I'm seeing it, conversation might be able to give an idea to the consultant. But then again, because of the understanding that some people might not even necessarily be able to explain their current state or the way they are naturally, that could possibly be a challenge. So what I'm trying to say with this is there maybe like a procedure they can put in place to ensure that they are giving them the right kind of prescription when it comes to contraceptives, so that it doesn't necessarily affect them in the way that they do not desire? Or it's just based off conversations?
Now, there are different kinds of contraceptives.
Okay.
There are oral contraceptives.
Okay.
You have short-acting contraception, long-acting contraception. Then you have reversible and irreversible kinds of contraception. If you're going to embark on any method, it depends on what your desires are. So sometimes contraception is used for prevention or for spacing of childbirth, or in some instances to permanently stop you from conceiving after you may have completed your family. The common methods that are used include the male condom, which is generally very safe and also has additional properties of preventing sexually transmitted infections.
Yeah.
So that is one easy one that can always be used. People feel uncomfortable with it sometimes because it is thought by some not to give you the kind of pleasure you desire, you derive from the sexual act. Okay. Now, for the female, the oral contraceptive pills are commonly available, not necessarily appropriate for everybody, and ideally, before you are giving such medication, you would have been examined, and all problems that might be associated with using the pills would have been excluded. So ideally, you should visit not necessarily a physician, because we have a lot of well-trained nurses who offer these same services. In most government hospitals, primary, secondary, tertiary, these services are generally provided by the nurses who are trained to do so. And from administration of condoms to pills, in fact, in many of these centers, contraception is even free of charge. And when finance becomes a problem, you can easily access these things there. So you have the intrauterine contraceptive device, for example, which is very effective, more than 99% effective, requires little or no supervision once it has been inserted. Once in a while you check. But there's this general misinformation that it causes uterine infections and all sorts of things. And some people even say, when it fails, you might even have a baby coming out with the contraceptive in his hand or her hand when born. All these are myths that should be dispelled. So that's misinformation is the real thing, Then commonly we also have a subdermal implant, which is a small device put under the skin that gives you protection for up to 5 years without you necessarily needing any supervision. But you need to be examined because it's not appropriate in obese women, for example. And those things need to be taken into consideration. Your medical situation would also come to play. If you have any medical conditions, hypertension, liver disease, or stuff like that, it should also be considered before you. But there is an appropriate method of contraception for everybody. And all you need to do is just visit the clinic, and I'm sure you'll get the appropriate advice and device that will work for you.
Okay, so there's something you just mentioned now, and I just wanted to clarify. You said there is something they put under the skin and it grants protection. Is it protection from reproduction, or does it include potential sexually transmittable diseases and infections as well? What kind of protection does it, give whoever it is that puts it under their skin?
So the main methods that would prevent STIs, that sexually transmitted infections, are barrier methods. You have the male condom and the female condom.
Okay.
Outside that, any other that does not prevent the contact of male and female reproductive organs is not likely to give you such protection.
Wow.
So this method I mentioned does not prevent sexually transmitted infections. Rather, it releases little amounts of a hormone known as progesterone over a long period of time. And the main action is to prevent you from getting pregnant, not to prevent infections.
Okay, all right then. Thank you so much for that clarification, sir. Because it now even leads me to the next question I want to ask you, because I've heard that there are specific medication that protects people from contracting STIs. Maybe they get involved in sexual activities with an affected person. I knew a lady who apparently she was speaking for a number of women when she once told me that after having unprotected sex, she would insert a pill in her vagina, and she believes that it completely protects her from any form of STI or STD. So are there actually pills that do that?
Absolutely not.
Wow.
There is no scientifically approved pill that you can insert in your vagina after sex to prevent STIs.
Wow.
The other practice is to take antibiotics.
Okay.
With the belief that would also work. But it's creating a bigger problem because misuse of such drugs promotes drug resistance, and organisms that would normally not be pathogenic or cause disease are able to cause disease when they shouldn't. So we advise against indiscriminate use of antibiotics or such drugs. So there's no pill that you can insert in your vagina that would prevent sexually transmitted diseases.
Wow.
There is post-exposure prophylaxis for HIV. So you could take some drugs that would hopefully reduce the likelihood of you contracting HIV after sexual intercourse. And this is especially useful in women who have the unfortunate experience of being raped and stuff like that,
okay,
which is administered to most of such. There are also vaginal gels that are being tested for HIV prevention, but they are not post-exposure solutions. However, they are still in the testing phase. So anybody claiming to be protected by using any pill inserted in the vagina is not providing you with correct information.
Wow.
And it is an extremely risky exercise.
Okay, all right. Thank you so much for that, because I was honestly shocked when I first heard that, but I didn't want to, because she made it seem as though that she got that kind of suggestion from a qualified person, her doctor, basically. So I'm glad that you were able to give this, response, because like I said, she spoke about how this is something that a lot of people actually believe works. So I'm glad that you're able to clear that air, that there's not necessarily anything. Yeah, you might be able to take some antibiotics that could have a positive effect, but that doesn't necessarily ascertain that you're immune from some of these, infections if you engage in sexual activities with somebody who is affected. But speaking, that was for the lady. I'm thinking now for guys. We know how risky it is to consume a lot of, all these roadside agbo and some of all these other small plastic drinks that, they have the intention to potentially last longer during sex. So I have two questions to this. The first one is, what is the most common problem that can arise from the consumption of these processed drinks? All these roadside drinks that they don't even necessarily know how it's produced. They just probably have adverts or people that tell them how it works. And what I'm thinking about this, especially because of the fact that you mentioned for contraceptives, it's relative. There are specific ones that could work for some kind of women. So they could possibly, if this is something that you would even somewhat suggest in a way, maybe specific ones, what are the potential issues that can arise from you consuming one just out of whatever you hear from somebody else? And the second question I would love to hear your response to is, I know there are natural alternatives that improve sexual activities. I've read up and I've heard a lot about it, especially fruits. There are specific fruits that help with that. But is there some form of medication that promotes longer sex time, that is healthy as well, very, very specific, that is healthy, that people can take rather than some of these roadside, concoctions, let me put it that way, that you don't even know how it was created?
The problem with these concussions is nobody really knows what they mix in there. We've had situations where we've had epidemics, so to say, of kidney failure, liver failure. We had a lot of that in Port Harcourt, where I live, after trade fairs. And each time they had those naturopathic trade fairs, you have a rise of people in the incidence of these kind of problems. So most of these medications have a lot of side effects, and they can cause liver disease, kidney disease, hypertension, amongst others. And in the long term, they even cause erectile dysfunction, and they have mental health implications, because a lot of them contain drugs that affect your mental state.
Wow.
And maybe psychotics or sedative and all that. So you have to be very careful. I really can't understand why anyone would take substances that have not been tested. Even those that have been tested have their own side effects, and these are all listed out in their packages. Now, regarding longevity of the process, the act needs to be carried out in a manner that would not facilitate early
ejaculation.
When you come,
Oh yeah, ejaculation.
So the whole idea is you should stay as long as possible.
Yes.
Before you reach the climax.
Yes.
Now, some men have erectile dysfunction, and there are proven drugs that help, such as sildenafil, which is also known as Viagra.
Okay.
And the Viagra market has made a lot of waves in the world. And then there are other alternatives like tadalafil, also known as Cialis. But these drugs should be taken under supervision. There are also behavioral techniques that can help, such as you stop, start, not just go continuously, or squeeze your groin muscles from time to time. And these are things that can be taught to you. In the women, they are called Kegels exercises, where you exercise the muscles of your perineum. Natural options also exist. You need to sleep well, rest, exercise, have a good diet, and avoid excessive alcohol, tobacco, and recreational drugs. In the euphoria of things initially, some people may have prolonged sustenance when you take drugs, but in the long term, they have negative effects. And if you begin to encounter sexual problems. Now, one other thing that is also important is the act itself. Before embarking on sexual intercourse, if you just go one bang and it's a one-time thing, you're not likely to last as much as if you are to take it slowly. Of course, under normal circumstances, there should be some form of closeness between you or intimacy between you and your partner. And foreplay is extremely important. So you work together towards achieving that longevity that you're looking for. For the man, I mean, we think you are macho, you're able to stay for long. I can remain for 1 hour without coming. And that's not true.
Yeah.
We need to be realistic in all these things.
Okay. A lot of people do not necessarily understand that there are simpler ways that can make you work in a better way that would be beneficial to both parties that are involved. You know, it's very, very important that people have that proper understanding. And now I'm thinking, you know, something more in line with the reproductive system. There's something that I've always heard, and a lot of people can definitely attest to this, that women need to be very careful what they consume whenever they're pregnant. You hear things like, oh, as a woman who is pregnant, you can't drink alcohol, you can't smoke if you've been smoking. There's specific food you can't necessarily eat for the sake of your child. You have to consume egg a lot because of choline that is present in the egg, or a bunch of other things. But one thing that I recently heard is that men also need to be very careful with what they consume for a period of time right before they decide that they are getting their partners pregnant. So I want you to please enlighten us, you know, myself and people that are listening, other men as well, even women as well. They can share the information to men connected to them. Enlighten us a bit more on this, especially when it comes to the men, when it has to do with the reproductive system of themselves and, of course, the women who they are choosing to perhaps potentially start a family with.
The conversation should actually be had before you start a family. And it's not something you just jump into without preparation. You know? Number of children you want to have, spacing of all those children, amongst other things. And if you don't prepare, you are more likely to have challenges in the long run. Specifically, male contribution to infertility is also very high. Our society is one in which generally the blame is placed on the woman, whereas in many instances that problem could be from the man. For the man, infections can be a problem, and many of these infections might not show you signs that there is a problem going on. Chlamydia is the most notable one. Gonorrhea and other sexually transmitted diseases usually have symptoms, and you'll be able to tell that you had such an infection. If improperly treated, the long-term effects could affect your capability to produce viable sperm. It's not only about the sperm count. We also look at the sperm motility, that's the movement of the sperm cells, and the morphology, that's the percentage of sperm cells that are normal in shape. So when couples present with fertility challenges, the male must also be investigated. And lifestyle problems. Lifestyle can also affect male functions. Excessive smoking, excessive drinking, all those other things you mentioned, agbo and all. Diseases in the man, diabetes, hypertension, even the drugs that are used for some of these disorders can affect male fertility. Recreational drugs, these days it appears that the use of recreational drugs is increasing in the society. And unfortunately, some people even utilize them when, especially for women, when you are pregnant, and that can negatively affect your fertility. So yes, male factor is significant, and a healthy male is more likely to be fertile than one who engages in harmful habits that could definitely affect his sexual and reproductive functions.
Okay, all right. Thank you so very much for that. And I'm now thinking, so what would you even definitely recommend that men do? You know, in terms of activities, you've kind of hinted at that, but specific things that in terms of consumption and activities is, I would say, lifestyle even, to ensure that because when I heard this, I heard that it could affect the way the child comes out. And even if it might not necessarily affect their physical form, it could affect their cognition, for instance. there are certain things that it could affect. So what kind of things would you suggest in terms of specific lifestyle behaviors that they need to ensure that is in place right before they start up thinking about, reproduction?
Generally, even for your personal well-being, healthy living is encouraged. So exercise, good diet,
Okay.
avoid excessive alcohol, tobacco, recreational drugs, and all that.
Okay.
And that way, now, direct link between lifestyles of men and the children, that's their offspring. It's a delicate thing. Once fertilization has occurred, it usually would only happen when you have good sperm. And at the end of the day, the development of the child is affected by what the pregnant mother does. In the formative stages, especially in the first trimester, when the organs are forming, if the woman exposes that child to harmful substances, drugs and stuff like that, that could negatively affect the development of the child. Of course, the man's role, he has deposited the sperm there, and if pregnancy eventually occurs, it is not likely that his lifestyle would have affected what that child eventually becomes like. But for you to have good chances of normal fertility, you need to be healthy as a man, just as the woman. And the emphasis I'm making is that when problems arise, most of the time the finger is pointed at the woman, whereas the problem may just be with the man. And all the other things we mentioned, problems with no sperm, erectile dysfunction, and all that, result from these lifestyle problems that exist.
Okay. And I'm glad you mentioned these things, and even something you said earlier when it comes to conversations like this, especially for people who are trying to get married, who are trying to start a family together. And it is something that is very, very important that they discuss together. The importance of discussing their sexual and reproductive health before marriage, because so many people do not necessarily understand how vital things like this are, especially when it comes to starting a family together. So I really appreciate you for mentioning these different things and ensuring that people absolutely have a proper understanding of this. So another thing I wanna speak to, and it's something you kind of mentioned earlier, misinformation, some misconceptions that people have about sexual and reproductive health. What are the most effective ways that you would say can address misinformation about sexual and reproductive health, especially here in Nigeria? Because some people do not, oh my, can't really get started, but some people just go around with different things that do not make sense, but it somewhat makes sense to them because it's not really harming them. So what would you say are the most effective ways that we can use to improve the proper circulation of the right kind of information?
Starting from early stages, if we're able to educate young children in schools in their formative years, it helps. Of course, so education is the key. Now, the quality of education seems to be dropping every day, and most of what we are discussing is not taught to kids in primary or even secondary school. And it is important that at that stage, they get the appropriate kind of information. If you are giving such information from the start, you are not likely to fall into the trap of getting misinformed. Unfortunately, the social media has propagated a lot of changes in our society, and people spend a lot of time getting wrong kind of info from social media. If you go to the internet and Google many things, you get a long list of stuff that has not been verified. And convincingly to that effect, when you see a Caucasian speaking and they speak in certain ways, we get carried away by a lot of misinformation. So it's not only from our society. So social influencers like you, for example, this your program is one of the media through which we can propagate proper information. And hopefully continue to extend this. So peer-to-peer review, peer-to-peer support,
Okay.
Teaching in schools, churches, any opportunity that we have, we should be able to provide such information. But more importantly, you should seek information from those who are trained and qualified to provide you with such information.
Okay, all right. Thank you so very much for that response, sir. And just to move back to something else that you mentioned that I think is very, very important that a lot of Nigerians put into consideration, because it gets as it be right now. It really, truly gets as it be. So, we did look at how the US aid has basically exempted Nigeria, considering the recent development of how the US aid has cut Nigeria off on a couple of benefits that the Nigerians, Nigeria and a bunch of other countries were assisted with. So considering that, because I know that at the very least, okay, for one instance of how they were tackling the assistance was used to tackle HIV, for instance. That is one of the major threats to the sexual health of the average Nigerian. So, if being up to you, what suggestion would you give to people in terms of lifestyle behavior that a lot of Nigerians need to ensure that they can put in place to maintain good sexual and reproductive health?
The USA thing is, I think, a wake-up call for us. I mentioned earlier that we depend too much on foreign aid to do whatever we do. And the current situation in our country is a reflection of how our dependence on assistance generally creates problems for us. We have some of the best trained doctors, nurses, all health practitioners in the world. And recently there was something on the social media. If all Nigerians are deported from the United States, for example, and the United Kingdom, many of their health systems would collapse because we have a very large proportion of our individuals working there. So in our own system here, we have qualified people who will be able to provide the appropriate information. Prevention is the key. And once we are able to work towards preventing illness, then we don't even need to get to that step of talking about HIV/AIDS. A lot of emphasis has been placed on HIV/AIDS, but there are many other problems that exist in our society. Maternal mortality, for example, is part of reproductive health we're talking about. And we have one of the highest maternal mortality rates in the world after India. So, I mean, it's not just about USAID. We need to get our systems properly set up. The government is now trying to make efforts towards intervening in areas where we were getting help from the United States. Hopefully, it will strengthen our own systems because we need to look inwards. With the current economic situation in the world and the kind of tariffs that Donald Trump is placing worldwide, it will definitely affect everything that we do beyond reproductive health. And whatever applies to these other aspects also applies to reproductive health. So we need to educate our people more, train those of us that are locally existent to provide this information. We train medical students, for example. If we all left the country, who's going to be left? Unfortunately, a lot of the younger people who are in training, their focus is not on working in the country, but everyone is thinking of how to live. Why? You can't blame them. The conditions in Nigeria are no longer conducive for anybody. So until we are able to improve our socio-economic situation, we will continue to have all these problems. Poverty, ignorance, propagate illness, and all the kind of problems that we have. So we also need to improve on the socio-economic situation of the country and strengthen our health systems from the primary to the secondary to the tertiary. Right now, most people go to private hospitals because of the fear of not getting proper care in government hospitals. In many instances, they may be right because there are a lot of delays and the bureaucracy is cumbersome. But healthcare in the private sector is also very expensive and not too many people can afford it. Majority of our population is living under abject poverty And I mean, recently they're talking about feeding with $1, and somebody comes on there and is telling us how in Nigeria we can feed well. Is that how we should be? If we address things that way, nothing can ever change. We should be thinking of how to improve the lot of our people. Yeah. So education is key. We need to encourage those that are within the system to keep them within the system, and the remuneration for health workers and all is extremely important. But beyond that, the systems, the infrastructure, the hospitals need to be properly managed. They need to be equipped. We need to have qualified personnel. UCH was in darkness for a very long period of time. That kind of thing shouldn't happen in a civilized place.
Absolutely.
And if that kind of hospital that was the mecca of even people from Saudi Arabia is going through that presently, our health indices will only continue to worsen. And maternal mortality is a surrogate for development. The higher the maternal mortality rate in any country, it's a reflection of how poor the economy is being managed. So we have a lot of work to do.
I agree.
And only we can do it for ourselves. We cannot bring in people from outside to solve our problems.
Absolutely. So, just like how you mentioned, only we can do it for ourselves. But of course, quite the bulk of the responsibility would also be allotted to our government. And I don't know how well I can speak about what the government is doing, but I don't know if, and I would love for you to speak on that as well, if perhaps you're certain about certain things that the government has put in place, especially since this new development from the USAID, not necessarily putting Nigeria on the beneficiary list anymore, and how that is somewhat of a wake-up call for Nigerians. What would you say perhaps is the government's approach to sexual and reproductive health ever since the USAID cut us off?
Well, you've heard all the pronouncements from the Minister of Health and all. We are reacting to that sudden bombshell. But we should be, in my view, more proactive towards solving the health problems. We have an emergency in our healthcare system in Nigeria. Without personnel, nothing can work, even if you bring in the best kind of equipment. We've experimented with all sorts of things. The key to a proper system lies in the 3 tiers: primary, secondary, tertiary. Primary healthcare is supposed to be the responsibility of local governments, while secondary is for the states and tertiary for the federal government. And in most states, primary healthcare system is not anything to write home about. Where you even have many health facilities, they are poorly manned. And we are getting into a crisis situation because we don't even have the personnel to replace those who have left. Recently, there was an interview with the medical doctors, I think the National Association of Resident Doctors, where they kept harping on the need to stem this brain drain. We're even talking about doctors. I think the nurses are even more affected than we are. And the number of nurses that have left this country are so many that something serious has to be done. So beyond just talking about stopgap measures for USAID and all that kind of stuff, we need to strengthen our health systems. And like I said, it is not only health alone. The allocation by the government to health does not meet what the WHO recommends. And if we do not fund health, there is no way that we're going to go anywhere. At the end of the day, most of us do not have the capacity or opportunity to go and seek healthcare elsewhere. Someone had suggested that those in government should not leave the shores of the country for healthcare. If they had to remain here to get treated, then maybe they will pay more attention to what is going on in the country. But when you have an opportunity and you can jet out at the twinkle of an eye to go and get healthcare, why would you bother about the common man like you and I? So we need more effort by government to stem all the issues that exist, including reproductive health. But it spans across the whole spectrum, from communicable to non-communicable diseases. When you still have epidemics of cholera, it's just a reflection of how poor our healthcare systems are.
Okay. All right. So, because of the sake of time, I wish, because this conversation is something that we can go on and on and on, but I would just love for us to, kind of wrap things up here. Hopefully, maybe some other time we can, delve into this conversation again if at a convenient time for you.